Good morning, everyone. So today we'll continue with the minimal invasive dentistry. We have discussed the introduction, principle, and the various minimal intervention approaches. So now we'll continue with the next part of the MID. After pit and fissure sealants, the next is preventive resin restorations. So preventive resin restoration is indicated in teeth with minimal teeth and fissures decay. In this, minimal cavity preparation is required to prevent the unnecessary removal of healthy tooth structures for retention. If the decay is limited to enamel, then no local analgesia is required. After etching, rinsing, and drying the cavity, it is condensed with normal composite or GIC. So this is the photograph in which we can see that early decay is treated with a preventive resin restoration. So it is a very incipient caries. Caries process has just begun. So we do the restoration with the composite or GIC, and it reduces the possibility that the disease will further progress. Coming to the types of PRR based on the extent and depth of the carious lesion. So in the tooth, we have the enamel, dentine, and pulp. So basically, the preventive resin restoration is classified into three types, type A, B, and C. Type A includes the suspicious pits and fissures where caries removal is limited to enamel. Type B is the incipient lesion in dentine, which is a small and confined. And type C is characterized by the need for greater exploratory preparation in the dentine, that is your deep dentinal caries, which are approaching pulp. So for that, we need to apply a base over which the restoration has to be done. So these are the three main types of the preventive resin restorations. Next is ART, that is atraumatic restorative technique or treatment. The atraumatic restorative treatment is a procedure based on removing the carious tooth tissues using hand instrument alone and restoring the cavity with an adhesive restorative material, that is mainly GIC. So the goals of ART are preserving the tooth structure, reducing infection, and avoiding discomfort. So this we can see how the ART procedures has been done. Firstly, we can see an incipient lesions. So for this, we use only the hand instrument. It is based on two principles. That first is removal of the carious part using hand instrument, and second is restoring the cavity using adhesive material like GIC. So with the help of the hatchet, we make an entrance into the cavity. We can see in the second figure. Then the C shows the removal of the caries using spoon excavator. And then we fill the adhesive material, that is the GIC. So this is how ART is being done. So what are the advantages of ART? It is easily available. Inexpensive hand instruments are used rather than expensive electrically driven dental equipment. So ART involves the removal of only decalcified tooth tissues, which results in relatively small cavities and conserves the sound tooth tissues as much as possible. The sound tooth tissue need not be cut for retention of filling material. The combined preventive and curative treatment can be done in one appointment. So it is a both preventive as well as a curative procedure. Disadvantages are that ART restorations are not long lasting. The average life is 2 years, depending upon the rate of caries activity of the individual oral cavity. ART has low wear resistance and low strength of the existing glass ionomer material limits the use. And the continuous use of hand instrument over long period of time may result in hand fatigue. The next is air abrasion. The instrument was first developed in 1940s by Robert Black. It is a method of tooth structure removal that is considered to be effective alternative to the standard dental drill. Teeth can be prepared to receive restoration by abrading the target tooth surface through pressure by a jet of aluminum oxide particles. 100 psi pressure is required for the cavity preparation. So this is the machine, that is air abrasion. It does not uses a drill. It uses a fine sand under pressure to remove the decay. So 27 to 50 micron size of the particles are liberated from the machine, which will help in the removal of the carious part. So for this, we have to project it with the high velocity and it will remove the caries. The abrasive particles strike the tooth with high velocity and removes a small amount of the tooth structure. The nozzle of the device for targeting the tooth surface, it is held at 0.5 to 2 millimeter away from the tooth. Advantages is that it is painless. Local anesthesia is rarely needed. It works quickly. There is no vibration or pressure to cause the microfractures that weakens the tooth. There is no production of heat to damage the dental pulp, and lesser sound tooth structure is removed. The disadvantages is that depth of penetration cannot be controlled easily. The preparation does not render a well-finished surface, and it cannot be used in patients having the history of hypersensitivity. So these are the disadvantages of air abrasion. Next is lasers. So laser, it stands for light amplification by stimulated emission of radiation. So lasers is the latest technique that have been used recently because it is a more or a less invasive and it is a painless procedure. So it operates at a wavelength of 2.94 micrometer and is used for the caries removal, cavity preparation in both enamel and dentine, and for the preparation of the root canals. The laser treatment is appreciated by patients as they are more comfortable than drilling. So different types of the lasers are available. So like a few of them are carbon dioxide laser, which causes caries inhibition up to 82.7%. ER-YAG laser, it causes a reduction in the surface lesion depth in the root surface around 39%, and for the enamel 56%. And ND-YAG laser with Durafat, it is causes caries inhibition and fissures reduction is 43%, and for smooth surface reduction is around 80%. So these are the different types of the lasers that have been available. Further, the lasers are of different types, different for the hard tissue lasers and different for the soft tissue lasers. So hard tissue lasers are used in the various procedures like CO2 laser, ER-YAG laser, and ND-YAG lasers that have been available. And it will cause less pain, less trauma to the patient, and it will help in reducing the caries. So it is a method of the minimal intervention and minimal invasion. So this is the diagram of the photograph where you can see the laser. It has been used for the caries removal. Next is the micro preparation and fissurotomy burrs. Many manufacturers are now producing smaller burrs for the cavity preparation. These burrs are spherical, tapered, or elliptical. Example, fissurotomy burrs by SSY USA and narrow diamond burrs by Brasler in USA. So these are different types of the burrs that have been used, smaller in size, so there will be less amount of the removal of the tooth structure. So this is how fissurotomy burrs are there. It will create a depth into the tooth surface, after which the restorations has been done. The instruments are manufactured using a high-speed tensile steel to produce a thin neck. Micropreparation burrs allow the dentist to conservatively explore and modify the fissures even when caries have spread laterally along the dentino-enamel junction. So this is the main advantage of these burrs. So come next is the ozone application. So ozone is a part of the natural gas mix that surrounds the earth at high altitude and protects world population from excessive ultraviolet radiation. The ozone technology was developed by Professor Edward Lynch. Ozone, that is an oxidant, it is toxic to carcinogenic microflora and acts by the oxidation of bacterial byproducts and metabolites. The technique uses ozone gas, which is applied to the tooth surface in a controlled manner with the use of heel ozone delivery handpiece. This ozone gas eliminates decay causing bacteria. Once the bacteria are eliminated, the treated surface can be restored or left to remineralize. So this is how the ozone delivery system works, where it has been left to the tooth surface and it will cause the demineralization. Next is the caries detection dye. This we will continue in the next class. Thank you.